All right. Hey, welcome everyone from OsteoStrong. Thanks so much for coming on the call tonight. For those that haven't met me yet, my name is Matt, the center manager. Um, Lately, we've had a bone audit that you would remember filling out. And one of the big things that came back from that was the fact that we didn't know much about hormone health. And that was something that the one area that everyone kind of couldn't find, I guess, an answer to at the time that could be the missing link to how they can help improve their bone density, not just the great things that we do in terms of the physical loading at OsteoStrong, but all those other aspects of the lifestyle as well. So Dr. Avi is the expert in this area, as well as metabolic health, which she'll chat to you today. So great for as you're going through that menopause, whether you're past it, through it, before it, just knowing all that information that you need to really go forward with as much knowledge and direction to be able to put you on the right path to the best place for your bone density to be at. So thank you so much, Abby.
Great. Well, thank you, Matt. Thank you, Matt and Woody, for having me to talk to the members on the Zoom tonight. Great. All right. So let me start a share screen. So welcome everybody from OsteoStrong coming on to the Zoom tonight. And you're most welcome to put in the chat where you're coming from. And any questions during the Zoom, most welcome to put in the chat. And I'll check the chat every now and then and answer any questions you might have. And I might leave some time at the end to answer any questions you might have about hormones and bone health and metabolic health. So I will just start a share screen and you can see the slides that I have prepared for you. So this is my slides. And tonight, the topic is balancing hormones for bone health and metabolic health. So just to introduce myself, I am a Dr. Avi Charlton from Melbourne Low Carb Clinic. My handle is Dr. Charlton Lifestyle GP on Facebook, Instagram. You can also find me on LinkedIn, YouTube, everywhere. The reason for me to be doing all this is I have set up a clinic called Melbourne Low Carb Clinic. I'm a GP for the last 20 years in Wantirna. This is Wantirna Mall Clinic, and I've branched out to set up this Melbourne Low Carb Clinic as a specialist GP clinic. I have two kids. They're both teenagers. This photo is a few years old, so they're much bigger boys now. I live in Donvale, and I have a farm at the Gerties near Phillip Island. So I've been a GP for 20 years, set up this clinic called Melbourne Low Carb Clinic 3 years ago just to get more of a special interest, not just treating coughs and colds for my own reward sake, just to get out of my normal GP work. So I have done lots of extra learning about managing obesity. I did some courses on low carb down under. I did nutrition network, and I am a Australasian Menopause Society member, not in here. But I've done sort of lots of training in metabolic health. I did some breathing training. ACNM is Australasian College of Nutrition and Environmental Medicine. So I've got lots of extra qualification, mainly started since COVID that I've started learning and did all this extra learning. Just to reiterate that this tonight isn't medical advice. You're most welcome to come and see me as a GP for any medical advice, and we can answer your questions about any specialist advice, any GP advice. So I want to ask you, is this what you feel sometimes? Because hormones is very tricky, and a lot of people have hormonal problems. They feel tired, hormonal, hot flushes, brain fog, weight keeps piling on. A lot of patients tell me that I'm just eating the same as what I'm eating, but my weight just keep piling on, especially in the belly. They might feel tired, burnt out, lots of aches and pains, inflammation. Put in the chat how you feel and if this relates to you. If you think you are hormonal and aches and pains and inflammation and you're still putting on weight and this is what you're struggling with. Yes, thank you, Beth. Beth says, yes, it relates to me. Can't move weight, more aches and pains, absolutely. And since you're all going to OsteoStrong, you might have realized that osteoporosis or osteopenia is really common. 1 in 2 women will break a bone because of osteoporosis. These are over 50. Men breaks 2. 1 in 4 men break bone. So it's so common. And we're going to talk about how we can manage our bone health, manage our metabolic health. So yeah, so I've got Madalena saying sleep is a big issue. Aches and pains and weight gain, very tired, says Diane. Belly fat, aches and tired. Sleep irregular is a big issue. So maybe hot flushes, maybe when you're going perimenopause, sleep can be a problem with your progesterone going up and down. Sometimes you're just waking up all the time. So that's bone health. It's so important that we need to look after our bones. And since you're all going to OsteoStrong, you are really looking after your bones, which is amazing. That is all great since you're all doing OsteoStrong. And what do I mean by metabolic health? Metabolic health means this little metabolic health means how we're using our fuel. So how we're using our sugar and our carbs and our fat, whatever we eat, and how we're burning our fuel. So this little mitochondria is the little powerhouse of the cell, and how the mitochondria is working governs the metabolic health. If you have poor metabolic health, which means metabolic syndrome, you've got higher chance of all these conditions, which is so common. It's all the modern diseases, heart disease, lipid problems, hypertension, diabetes, even dementia, cancer, polycystic ovarian syndrome, fatty liver, they're all part of the metabolic syndrome condition. So improving your metabolic health is so important to avoid chronic conditions. And all these words you might feel, because I can see it in the chat, aches and pains and poor sleep, there might be weight gain, low mood, bloating, hot flushes, heavy periods, tired. They're all symptoms of menopause. So since you're all here, you've all got an interest on learning how to manage menopause. So you keep putting in the chat how you feel and what is bothering you. And at the end, you have some questions. I mean, you have some chance that you can answer. You can ask me questions. And if you want to put some quick questions, you can put in the chat as well. So menopause is such a buzzword this year, I feel. I've been a GP for 20 years, and I feel like this year, everybody's talking about menopause, so much media attention. And I actually feel like I'm dishing out hormone replacement therapy, HRT. So we can talk about the benefits of hormones in a minute. So you can actually look at all the symptoms of menopause. This is Healthy Hormones is a website organized by a Sydney GP. She done this questionnaire. You can look at all these symptoms for menopause: anxiety, difficulty sleeping, irritability, feeling unhappy, depressed. We're now understanding lots of mental health conditions can be related to menopause as well. You can actually feel anxious and you can have headaches, pins and needles, funny symptoms like crawling pins and needles in your body. Some people have brain fog, memory problems, and bloatiness, weight gain is really common, or heartburn. Aches and pains is we're recognizing that's probably because of your hormones going up and down, causing inflammation. Dry eyes, hair thinning. Formication is the sensation of insects crawling over skin. Hot flushes impacting on your work. You might not be able to concentrate. So you can go to this QR code and check out Healthy Hormones, which is run by a Sydney GP. So to answer your questions, Michelle says, poor sleep, aches and pains in joints. Absolutely, that is really common. So hopefully we can help you with assisting some help. HRT, what works best? Yeah, so we'll go into HRT. We'll go into what HRT you can consider, and you can certainly come in and see me as a GP, and we can help you with some HRT options and lifestyle options. And we'll talk a bit more tonight as well. Wendy says, is this relevant for someone who went through menopause decades ago? Well, yes, because we're actually knowing that some women have perimenopausal symptoms up to 10 years before they stop periods. And some women have ongoing menopausal symptoms for many 10, 20 years after they finish menopause. So Diane and Wendy have gone through menopause, could be 10 years ago, and some women still have hormonal symptoms. Certainly, we might have to look into if there's something else going on. So maybe touching base with your GP or coming to see me to talk about, could it be something else? Or it could just be menopause hormones. It can last for forever. So there are, Diane says, huge issues with dry eyes, ulcers in my eyes, all very painful. Absolutely. So that could be part of the symptoms. And it's certainly here, dry eyes is one of the symptoms. Oh, Michelle says dry eyes too. Luz says, is it possible to start HRT after menopause at age 64? And what are the risks? Yeah, we'll go into that. So stay tuned. Keep listening. This is what happens when you're premenopause. Your hormones go up and down, nicely cyclical, and you really should have, I mean, those people who are premenopause should have periods that are regular, ideally 28, 30 days coming regularly. And if you're not having regular periods, it could be something wrong that we might have to look at. When you're perimenopause, means you're going through menopause, your estrogen, progesterone go up and down all over the place. And it can be throughout one day, it can be so much highs and lows, and it causes hot flashes up and down. And when you're postmenopause, you are running out of your estrogen, which is the green line. You are running low on your progesterone. And we can test that follicle stimulating hormone, FSH, and we can find it really high, and the luteinizing hormone really high. So we can do blood tests, but the blood tests won't show until you're postmenopause. So a lot of GPs now are just diagnosing menopause based on symptoms, because we now know perimenopause can be in your early 40s, even late 30s. So it can be 8 to 10 years before you stop periods. And postmenopause, we can have symptoms that last for a very long time. And these are the hormones that we need to look at. Estrogen really runs out after menopause, and estrogen maintains skin health, and there might be dry eyes that, because you're running out of estrogen, that might cause dry eyes. Progesterone helps with sleep. So if you're running low on progesterone, that might be affecting your sleep. It might be affecting your mood as well if you're low in progesterone. Testosterone, traditionally, we're thinking low in testosterone will affect your sex drive, libido. But we're now thinking that testosterone might affect your brain health and concentration and even mood. Because if you're low in mood, you don't even feel like doing anything. So we can think about testosterone replacements as well. Does it mean, so Wendy says, does this mean hormone replacement ceases to be useful in your 70s when menopause was 25 years ago? Not necessarily. We're now thinking menopause hormones can be used up to, can be in older women as well. So it might be helpful for you. Insulin is the hormone that's really important to think about. So insulin is not a female hormone because a lot of men are insulin resistant as well. So I like to talk about insulin because it is so common that people get insulin resistant. And when you're running low on estrogen, you get more insulin resistant. Means that this hormone insulin will not work as well. Insulin is the hormone that stores glucose to store it to become fat. If you're low in insulin, you will if you're high in insulin, you will store more and more fat. So regulating insulin, and we'll talk about how to regulate insulin. Cortisol is really important because everybody is stressed. So many people are stressed. Maybe you're looking after your grandchildren, maybe your children are giving you a hard time. Maybe you're just running around from one place to another. So cortisol doesn't help you to regulate your weight and doesn't help with insulin. Thyroid hormone might be important to check as well. So Christine's asking, can HRT help recovery from parathyroidism, hypoparathyroid? Maybe. So I think that needs a personalized medical advice. So maybe you need to come and see me or a hormone specialist doctor or even your GP. Michelle says, I've been on HRT since late 50s and now 75, still on HRT, feel normal on it or more normal. There you go. So, you're welcome, Christine. Welcome to ask any question, put in the chat. I've got some more people coming in. So how do we treat menopause? So this is my formulation for treatment of menopause because menopause hormone therapy, what happens is because of the Women's Health Initiative 20 years ago, we as GPs have been very reluctant to be prescribing hormone therapy, HRT, or menopause hormone therapy. You can interchange, we can say MHT or HRT, same thing. So a lot of GPs haven't been learning HRT, MHT, because there's this health scare in this study called Women's Health Initiative 20 years ago that are scaring us GPs, and we've stopped learning. A lot of GPs are scared and we worry about prescribing HRT. So there's more and more GPs taking up prescribing, and I have learned a whole lot more in the last year or two. And we're learning HRT is actually quite safe rather than causing breast cancer or strokes. And we'll go into the risks and benefits a bit later. I also like to talk about lifestyle because all these things can help with managing symptoms, managing your nutrition, eating real food, whole food, and I talk about low carb, and we can go into that later. I talk about managing your sleep, going to bed at right time, good consistency, managing circadian health can be really helpful. Strength training, going to OsteoStrong, lifting weights can also help with symptoms. And having the right support and even connecting with your community can be really great. So we'll go into each of these in a minute. Joshua says, is there any alternative to HRT? Yes, you can actually have some other medications, like there's blood pressure tablets called clonidine, which can help with hot flushes. There are herbs like black cohosh or remifemin that can help with symptoms. And I believe lots of these lifestyle things can help with symptoms as well. So there are quite a few alternatives to HRT. So absolutely. Again, HRT or MHT has been not prescribed a lot because of the Women's Health Initiative. So don't go blaming your doctor for not prescribing you with HRT. We just haven't been learning, and we've stopped learning for 20 years. And a lot of doctors are just not educated enough and scared. So I have done a whole lot more extra learning just in the last few years on prescribing HRT. And I feel that just this year, I've been dishing out a whole lot more HRT. Certainly, there are risks and benefits, and giving informed consent, telling you what the good and the bad will make you empowered to make a decision on if HRT is for you. So, more about HRT. There are so many benefits of HRT now where we are recognizing. So certainly improves your symptoms, improve hot flushes, maybe improve your dry eyes, maybe improve your aches and pains, frozen shoulder, inflammation, or brain fog. And we're understanding HRT can help to protect our heart, protect our brain, and reduce cognitive decline or reduce the risk of dementia. Osteoporosis, because you're all here going to OsteoStrong, we all want to improve our brain health. HRT is now recognized as one of the treatments to improve bone health and build bone density. So it is a well-recognized treatment if you have osteopenia or osteoporosis. So just to say, osteopenia is just not quite osteoporosis, not as bad, but a little bit low bone density, but not qualified as very low. But osteoporosis is just classified as that because we're meeting the criteria of less than 2.5 standard deviations. Osteoarthritis is aches and pains. So as I said, osteoarthritis can be because of the inflammation, and HRT can certainly help with aches and pains. HRT can reduce type 2 diabetes or reduce your risk of it, reduce the risk of autoimmune conditions, help you with not putting on so much weight, helps with mental health conditions, depression, even psychosis, even reduce the risk of cancer. So we're now recognizing so much benefits of having HRT. So there's been a saying I'm having complications from HRT to balloon at the moment, but the gynecologist I'm seeing strongly advise I continue with it. I think that requires a personalized medical advice. So I'm not here to say the gynecologist is wrong. Yeah, it's a bit hard not knowing your medical history. So if you're not sure, you can most welcome to seek a second opinion, whether you want to see a different gynecologist or whether you want to come and have a chat. I need to know your medical history. So osteopenia certainly is great for HRT. Can you please expand on the difference between HRT and bioidentical HRT? Yes, so we're going to, there's a few slides. Actually, the next slide, we're going to that. Michelle says, I've been on tibolone for 20 years and changed to estrogel. Oh, well, there you go. Maybe you can give it a go. And Despina says, you understand. Great. All right. So there are so many preparations for HRT. The Premarin and Provera is very, very old. This was what my mum used to have. My mum's 83, just so you know. And just so you know, I am perimenopause as well. I'm 50 last month. So I am totally understanding what menopause women are going through. But when mum went through menopause, she was prescribed with no questions at all. She was dished out Premarin and Provera. But we are now understanding these hormones are very old. They are synthetic and they are not really body identical. What we are prescribing nowadays is, this is really common, estrogel and prometrium. This is the mainstay of what we're prescribing. Body identical, it's very similar to what our body makes. Estrogen, it comes in the form of estrogel. So you can put in your couple of pumps, put in your arm one side, let it dry for 5 minutes before you put your clothes on. Prometrium is you take it at night. You have to have prometrium, progesterone, if you have a uterus. So if you haven't had a hysterectomy, you have to have progesterone or prometrium. Otherwise, there's higher chance of uterine cancer. Prometrium or progesterone actually helps you sleep and helps you relax. So there's benefits of each of them. And then there's this, let's talk about the patch first. The patch, I haven't got a brand here, but there's so many different patches that has estrogen and progesterone. So they're not prescribed as much, but you certainly can consider these patches. And then there's this Ovestin vaginal gel cream or pessary. These can be inserted into the vagina and certainly can help with dry vagina and difficult intercourse symptoms because it can be very dry. Frequent urine infections can be helped with these symptoms. So there's so many different types of hormones. And then there are bioidentical hormones. So we call this body identical. The bioidentical is compounded hormones. It can be estrogen, progesterone, and then there's even testosterone and DHEA. You can get testosterone and DHEA as a prescription as well. I haven't put it in the picture. But bioidentical is compounded. We're not saying bioidentical is not as good, but they're not regulated by TGA. So we don't know exactly the formula of what goes into the compound. It might well be totally fine, but it's not regulated by the Therapeutic Goods Administration. So Michelle says, is it better post-hysterectomy to have both estrogel and testosterone or just estrogel? Well, I don't know because I don't know your history. So certainly estrogel will have beneficial effects for symptoms like hot flushes, brain fog. Testosterone is traditionally used for low libido. But for me, when I prescribe hormones, I usually do start with estrogel first, and then I say we can consider testosterone if there's more symptoms that we want to treat, especially low libido and maybe mental health. Sandra says, is Ovestin regarded HRT? It is regarded HRT, but it is very, very little is absorbed into the body system. So we're now thinking the vaginal estrogen, not much is absorbed and very, very little risk, especially with the traditional risks that we're worried about, breast cancer and clots. So even if you have breast cancer or again, you should talk to your doctor about it and talk about personalized medical advice, but Ovestin is very, very safe. So yeah, twice a week. Usually the course is every day for 2 weeks and then wean down to twice a week. So certainly twice a week helps with lubricating vagina, reduce urine infections, and helps with intercourse. So this is a very, very busy slide. This is from the Practitioner's Toolkit for Managing Menopause. It is targeted to practitioners like GPs like me, but I just want you to look at down here because the contraindication for having hormones is these 6 things. If you've got an estrogen-dependent cancer, if you've got active clots, if you personally don't want to use hormones, if you have undiagnosed vaginal bleeding, like we don't know what the bleeding is about, if you have severe active liver disease, or if you have untreated or uncontrolled CVD, cardiovascular disease. So these are the contraindications. But even if you have high breast cancer risk, we can consider, it's just a caution. So we can consider HRT based on weighing the risk gains and benefits, informed decision. So we can talk about it, not absolutely contraindicated. And then these are the indications for non-oral estrogen. If you've got high triglyceride, liver disease, migraines. So we can also consider all these conditions might be worth considering HRT as well, or caution HRT. So Despina and Michelle, Despina says weaning off tibolone. Yeah, I don't think there's any, you don't have to wean off. If you don't like it, you can stop it, as said by Michelle. So yeah, very busy slide, apologies, but there's not a lot of absolute contraindications for HRT. So if you're considering it, certainly come and speak to me or go and speak to a hormone-friendly doctor, which you can find in the Australasian Menopause Society. There's a website with a whole list of doctors near you, and I will go into where you can find me at the end of the slides. This is about osteoporosis because we're talking about bone health in this talk. So the T-score is when you have osteoporosis. The treatment for osteoporosis is definitely if you have a T-score of less than 1.8 to less than 2.5. So these people have diagnosis osteopenia, so not very low, but a little bit low. Really, the treatment protocol is consider MHT or tibolone after risk assessment. So we're encouraging women to consider HRT for the treatment of osteopenia and definitely for osteoporosis as well. So part of the treatment for osteopenia, bone health is hormone replacement. Despina says, do gynecologists lie? Because I was told there's a whole process to it. Honestly, we are not stupid people and yet treat it like absolute monkeys at mercy for women. Oh, I'm sorry that you had not great experience. As I said, us doctors haven't been learning hormones for 20 years. So maybe the doctor's extra cautious. So, but there are lots of more hormone-friendly doctors coming about. Christine says, just to clarify, having an estrogen-sensitive breast cancer is a contraindication for HRT. Well, it depends. It's hard to say. It depends. So some women have had informed decision and they might still want to consider HRT. It is your decision and documenting your decision is important. So it's not too late to start at 62. Well, no, I don't think it's too late. And you might want to just have a very low dose of estrogen and you can try and see how your symptom goes. This is a handout from the Australasian Menopause Society. Again, these are the symptoms of menopause, hot flushes, mood changes, problems sleeping. And there's all these different preparations of HRT that you can consider. Tablets and capsules are really not prescribed a lot nowadays. And we are using a lot more patches, gels, and intravaginal hormone HRT. And then there's the risks is the patches and hormones have very minimal or no risk. The tablets have a little bit higher risk, and the patches and gels have minimal or no risk of increasing the risk of clots. Vaginal estrogen is it's safe long-term. It says here, except after breast cancer, but we're thinking it's really very, very little risk now. Heart disease, we're not thinking there's risk. Breast cancer depends on your informed consent, and stroke is, we're not thinking there's increased risk of strokes. So is HRT, so Jashari says, is HRT prescribed only once you enter menopause? If you're in perimenopause and osteopenia, are you still prescribed HRT? Well, we're prescribing HRT even before menopause, before your period stop, for symptoms, because a lot of people have symptoms before your period stop. And certainly perimenopause, if you get HRT when you're in perimenopause, that can really help your symptoms and help you reduce your symptoms. Despina says, am I sharing my slides? If you like, I can share them and I can email it to Woody and Matt. Is it too late to start HRT at 80 when you've had a hysterectomy 30 years ago? It depends on your condition, and I'm thinking if you have symptoms, maybe you can try a little bit of estrogen even if you're 80. Yeah, so sure. Michelle says, share sites, please. No problem. This is a risk and benefit slides done by Louise Newson. So Louise Newson is a UK menopause GP. So you can search up Louise Newson. She's got lots of podcasts and lots of information about menopause. So the benefits first of HRT is it actually reduces risk of dying of all-cause mortality. When you're young and between 50 to 59, you can have less risk of dying if you have HRT. So the first row is if you have nothing, you have 7 women will die in 1,000. If you have synthetic estrogen, which is the older type, 2 less women will die. If you have the newer estrogen, 2.5 less women will die. If you're older, you have 8.5 women less will die in 1,000 women. So you're less risk of dying if you have HRT. You have less women having heart attacks. So 4 fewer women in 1,000 will have heart attacks if you're young. If you're older, so young as in 50 to 59, if you're older, 60 to 69, you have 9 fewer women to have heart disease. So HRT is certainly protecting you from dying, protecting you from heart disease. It also protects you from having diabetes. So 4.5 fewer women will have diabetes when you're young, and 6 fewer women will have diabetes when you're 60 to 69. And with osteoporosis, you have much fewer fractures. 7 women have, so less than 7 fewer women have fractures when you're younger, and 5 fewer women will have fractures when you're older. And you've got much less risk of dementia if you have hormones. So we've got so many benefits: heart disease, osteoporosis, diabetes, and dementia that we're protecting. Now we're coming to the risks. If you have HRT, if you don't have HRT, you have 23 cases per 1,000. You have a little bit more, 4 more cases if you are having synthetic progesterone, which is the older type progesterone. If you don't have a uterus and you just have estrogen with body identical, if you have estrogen alone, then you have less women with breast cancer. But if you have body identical progesterone and estrogen, you are at the same risk as the women that don't have any HRT. And if you have a couple of glasses of wine every night, you have higher chance of breast cancer. So Despina says, does vitamin D interfere adversely with whatever the intake of tibolone is? Sorry, I can't answer that question. Not sure. Don't know about that one. Sandra says, doesn't a healthy lifestyle prevent all these issues instead of getting HRT? Absolutely, which I'm going to get in a minute, because Woody really want me to talk about HRT. So I'm really concentrating on HRT first, which I'm really going to talk about healthy lifestyle in 2 slides time. So yes, we should be informed about HRT, but we will go into without HRT will be great as well. So with having clots, you do have a little bit higher chance of having clots if you have synthetic progesterone. But if you have transdermal, the newer type transdermal estrogen with body identical progesterone, we're not thinking there's higher chance of clots. And even in older women as well. With the strokes, there's not increase of strokes. And if you're older, if you have body identical estrogen and progesterone, not higher chance of strokes. So that's all the information, all the slides that I've got with HRT. Again, it needs to be personalized. So I really encourage you to see a hormone-friendly doctor or come and see me, and I'll tell you at the end where you can find me. And yes, so I would get into healthy lifestyle, which I'm totally for because I am a lifestyle GP. I talk about eating healthy, stress management, community support, strength training, and sleep. I am actually a breathwork facilitator. If you want to learn about breathwork, you can come in to see me as well as part of stress management. So, Despina says, with all due respect, Sandra, in our ideal world, we'll still be healthy and raging with all the right hormones. So let's talk about lifestyle. I really talk about prioritizing nutrition. So we need to eat real food because so many people are eating sugar processed foods. And in fact, 70% of the supermarket is all processed foods. So you need to be aware, and we need to eat real food, healthy food, lots of protein. And we've been taught to fear fat, but healthy fat is so important for hormones and brain health. So good healthy fat is like olive oil, nuts and seeds, avocado, even fat around the meat is great. Butter, yogurt, they're all good healthy fats. And thinking about eating healthy fat and not having a low fat diet is really important. And some of us really want to reduce carbohydrates, reduce fat, might really need to reduce your carbs. So carbs as in sugar, processed foods at least, and if not, avoid the bread, potato, pasta. If you really want to lose weight, can really help with improving insulin resistance, which gets worse with low estrogen. So yeah, Michelle, Peter Attia, I follow him as well. Certainly he's got lots of information on hormones as well. So Michelle is into low carb, absolutely. Quite a lot of people who is in the low carb space don't have much symptoms on menopause. And just to reiterate, carbohydrates is glucose molecules linked together. If you know carbs is sugar, you might not want to eat all the sugar. So all the bread, potato, pasta, rice, even if you say potato, sweet potato, whole grain bread, wholemeal bread is all still become sugar. Even fruit. So just be careful with fruit as well. So people think fruit is really healthy, but fruit still becomes sugar and fructose. So I test insulin, which is a hormone which builds up with too much insulin. So I can do a blood test on insulin and see if you're insulin resistant. If we have signs that you are insulin resistant, you can reduce your insulin and manage it way before you become type 2 diabetic. And we can warn you before you become diabetic that you are pre-diabetes, so you can manage reducing this insulin. The insulin blood test is not usually tested by your regular doctor. So this is what I organize is insulin blood tests. These are the signs of insulin resistant. You have weight gain in your belly. You're tired, skin tag, hunger, brain fog, high blood pressure, frequent infections like urine infections. So this is what my bread and butter is, improve insulin resistance. So Sandra says, do I promote fasting? Yes, absolutely. So I promote intermittent fasting doing a 16-8 would be great. Even if you don't do a 16-8, having 3 meals a day, not snacking, is amazing already. And then you can advance to 24-hour fast if you want to go the next step. So just to reiterate, nutrition, prioritize your nutrition to fuel your body. We need to think about fueling your body, not restriction. Restriction means, oh, I can't eat all the good. We want to cut down calories. Cutting down calories doesn't work, and that will actually starve you, similar to the Ozempic. So prioritizing good healthy foods, good protein, healthy fat is really important. Stop doing anything low fat. It's really outdated advice on nutrition. Know your carb tolerance so we can test it, or if you know you want to lose fat, then your carbs might not be your friend. Avoid seed oil, vegetable oil. They are processed food. Fasting is optional. Avoiding snacks is a good step, and you can get your blood test. The next thing to optimize lifestyle is strength training, and you're all going to OsteoStrong, building muscles, which is great. And you can also do all these exercises like picking something that you enjoy, going for walking, strength training, lifting weights. Even if you do pickleball, a lot of older population like pickleball, anything that you enjoy is what's great. Sleep, and I talk about circadian health a lot because I have looked into circadian health. Getting to bed really consistently can help. Sleep is not optional. You need to sleep. Getting morning sunlight can help you sleep. And I talk about getting outside first thing in the morning, at least 5 to 10 minutes. Don't wear sunglasses in the morning sun. You're not going to burn because there's no UV rays in the morning. There's only UV rays in the middle of the day between 10 and 2. If you're out there for more than 15 minutes, there may be sunglasses and sunscreen, but we really need sunlight. Reducing artificial light in the day and the evening can really help. Grounding is just putting your foot on the grass. So that can help to reduce inflammation, improve your sleep as well. Despina says skin tags. She has skin tags, but none of the other symptoms. Don't know, you might want a blood test to check your fasting insulin. So we can think about a blood test for a checkup. Tai Chi, how does that help with bone density? It helps with muscle strength, and helping muscle strength can help building bone. So Sandra says, I believe everything you're saying. Well, thank you very much. Stress, everyone's stress. So having stress will raise your blood glucose. It'll raise your cortisol. That won't be helpful for hormonal symptoms. Then you can't manage hormonal symptoms. I don't say that you can stop the stress from coming in because there's always going to be stress, like you might get someone might suddenly die or be ill that you can't control. But learning how to manage stress will really be helpful so you can not be as affected when the stress comes on. So I do meditation, I do breath work. Practicing mindfulness just means that you're worried about what's happening right now, not yesterday, not tomorrow. So maybe just practicing not worrying too much can be really helpful, and managing here and now. Practicing gratefulness or journaling, and there are health apps that you can use to track your progress. And certainly cigarettes and alcohol and substances will not be helpful in your journey. Having healthy relationships will be really supportive, and sometimes just having a friend to catch up can be really helpful, to catch up on what's happening, share your journey, accountability, and have support. So yeah, Despina says, my mind juggles 3 to 5 things at one time. It is, lots of people do that, and maybe practicing juggle one thing at the moment. Just, you don't have to berate yourself, just concentrating here and now, and then before you worry about too many things at the same time. This is what I work on: managing nutrition, sleep, movement, addictions like cigarettes, alcohol, even screen addiction, stress management like breathwork, mindfulness, and having a community to support. And because menopause, I really am happy to prescribe menopause hormones as well as all the other lifestyle things. So put in the chat what other questions you've got and I will get into it. I just wrote a book. You can look into my website and consider buying my book. It is mostly about lifestyle, little bit about hormones, and I talk about how you can use lifestyle to manage your health and create vibrant health for weight loss. So if you're keen, you can go on my website and I will post it for you. I will sign my name on the book as well. I'll put in the post. And I've prepared a whole lot of free resources in this QR code. When you scan this QR code, you can go into lots of downloadables, free ebook, and there is a feedback on what you think about my talk. I just want to practice talking, spread my knowledge, and if you're keen to see me, come in to see me for a personalized consultation. And you are subscribed to my newsletter. If you don't like it, most welcome to unsubscribe and I won't be offended. I have a podcast and you can ask me to come and speak at your next event because I really love spreading the word of healthy message. You can come into my website and you can book an appointment or you can book a free 15-minute discovery call if you're not quite sure if I can be of help. I'm spreading myself out to all these locations. So South Yarra might be closest to you and Wantirna, Pascoe Vale, South, Beaumaris, Canterbury is once a fortnight, once a month, I'm in Beaumaris and Canterbury. So you can come in to see me as a one-on-one consultation. And I hope this has been useful. Most welcome to come on my website. Check me out on social media, Dr. Charlton Lifestyle GP on Facebook, Instagram. And I hope you find this talk helpful. I will put this slide up so you can scan the QR code and you can connect with me. And as I said, you are all subscribed to my newsletter. If you don't like it, just unsubscribe. And if you want me to spread a message into your world, if you've got a church or someone, a group that you want me to talk to, most welcome. And you can send me an email. There's links on my website. So let me know what you think on the chat. And you can, any questions or any feedbacks, most welcome to leave it on the chat. And there is a feedback form on the QR code that you can leave me. So I hope this is helpful. And I really want to spread the message of hormones is fine, mostly, but individualized medical advice. And work on lifestyle, eat good foods, strength training, work on stress management, getting outside, do some grounding, and I hope this has been helpful. So I reached out to Woody to try and get a talk, and of course, part of me wants a lot more of you to come and see me as a GP, but I just want you to learn about lifestyle. And if you just follow me on social media, listen to my podcast, then I have been rewarded that my lifestyle message has been spread. And if you feel like somebody else or a friend that might benefit from this talk, I will put it on YouTube and you can share it. I will email it to Woody. I will email the slides to Woody. And then we can spread the message. Diane says, oh, Despina says, where am I located? Is these 5 locations. So it's all on my website. I'm usually in Wantirna, but South Yarra I'm in once a fortnight, Pascoe Vale once a fortnight, Beaumaris once a month, Canterbury once a month. So Canterbury, I haven't quite opened up the bookings as yet because it was just finalized on the weekend. So stay tuned, Despina, and you might I'll put in the newsletter that when I open up the bookings for Canterbury, I will start in 4 weeks' time in Canterbury. So Lucy says you live in Darwin. So I do telehealth as well. I should put down here telehealth. So you can consult with me telehealth, except Medicare won't pay you Medicare rebates, unfortunately. Your daughter can come and see me, absolutely. So Jeshuri wants to sign up to low carb course. There's a free course on benefits of low carb on my website. There is a comprehensive course as well, and then you can also see me. There is a membership as well called Low Carb Pro. It's all on my website. You can go to mlcclinic.com.au. And I thank you all for your feedback. Jacinta, thank you. Oh, you followed me for a while. Well, thank you very much. You do weights, and thank you for following me. So any other feedback or questions, I'm very happy to stay back and answer any questions. And if you want to support me, buy my book. You can also get an Amazon version by searching Prescribing Lifestyle. An ebook on Amazon is just $9.90. You can get Amazon to post you my book. You can go to my site and I will post you my book. So I'm just very keen to spread lifestyle messages. But as I said, hormones is great. Most people would be okay, but individual medical advice. So follow me on Dr. Charlton Lifestyle GP, and you can have all the resources in this QR code. Sandra says, reading Walter Longo's book. Are you familiar with him? Yes, I know Walter Longo. I think he's more of a cancer specialist. So he does low carb ketogenic diets for cancer. So yeah, I do follow him. I haven't read his book, too many books that I want to read. So no, I haven't read his book, but I am familiar with him. So yeah, thank you for following me, Michelle. Again, it's Dr. Charlton, Lifestyle GP. If you don't want to spend any money, you can follow me on social media, Facebook, LinkedIn, Instagram, YouTube. There's my podcast. My podcast is called Prescribing Lifestyle Podcast. Thank you, Diane, for your feedback. Very informative presentation. Great. So anybody has any more questions? I will stop sharing, and if you want to unmute yourself, you are most welcome to unmute and ask a question. I don't know if Matt's still here. He might have left. He might be the only male that came on just to introduce me. Yes, Diane, you want to ask a question?
Oh, no, I was sorry, I was testing it out.
Oh, yeah, that's okay, no problem.
I was watching how it works. So
okay.
How does this work? And I didn't realize that it automatically you could see it. I didn't know. So I haven't got a question, sorry.
No worries, all good. Great. Anybody got any questions? So yeah, Dr. Charlton Lifestyle GP is the Facebook and Instagram, and Prescribing Lifestyle Podcast. And if you search Melbourne Low Carb Clinic, you can go to Google and I should come up on my website. All right, well, if there's no questions, I will stay for a few minutes more and we'll call it a night. Thank you very much, everybody, for coming on, and I hope it's been helpful to your health journey. So it's never too late to keep learning, even if some of you are 60, 70, 80, 90, doesn't matter. You can all keep learning about lifestyle, how to live the next stage of your life.
Dr. Avey?
Yes.
Can you hear me?
Yes, Michelle.
Yeah. I've been started HRT back in late 50s, and I've been on it was called Climbing when I lived in Europe. When I relocated to Australia, they didn't have it here, so they put me on Tibolone.
Okay.
And then I was diagnosed with endometrial adenocarcinoma, very, 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 very early stages.
All right.
and which was fantastic. And so I had a hysterectomy, and
All right.
the doctors at the hospital highly recommended that I get off Tibolone because they felt like that may have been the catalyst
Yeah.
which was
Okay.
fine, which
Yep.
was fine. So, but I am a big believer in HRT. I'm still young, but I'm old, if you know what I mean. I'm very young,
Yeah.
and I've been reading. I have a brother who's a doctor, and he recommended I look at Peter Attia's podcasts and look at Rachel, because she's really big on female menopause and hormone replacement therapy.
Yeah. Yeah.
So I went to my GP, and so I'm on estrogel now.
Oh,
But
yeah. You said, yeah.
which I'm just now starting. And because when I
Okay.
was on HRT, I feel normal. Before, they tried me in all different kinds, and I had big boobs, or I felt like I was pregnant.
Yeah.
It took a long time to really regulate what worked for me.
Sure.
So I was kind of scared to get off of HRT. I didn't want to because osteoporosis is in my family.
Yeah.
And I had osteopenia, but now since going to OsteoStrong, my bone density has increased 14.3%, which is
Woohoo. Well done.
yeah. So I'm so excited about that. And my endocrinologist fired me as a patient because I didn't want to take Actonel.
Oh,
But anyway, that's okay. That's okay. But my question is, so my GP's got me on estrogel, which I'm just starting, but I asked to be also on testosterone, but she didn't want to put me on testosterone, which I don't really I mean, I don't really have sex, so I am married, but it's just not really a sex life.
Sure.
But,
Okay.
but testosterone, as I understand correctly, is still beneficial to do a combination of HRT plus testosterone. So it's not a negative, is it, to have testosterone and estrogel?
No, I wouldn't think so. There's
No, I didn't
talk
think
that with testosterone, you really should measure testosterone and have blood tests to make sure.
Okay.
Yeah.
So that's what I need to do first. Okay.
Yeah, may be worth considering. So I'm not ruling it out.
Yeah. So I would then just start on estrogel and see how I go, and then maybe later and look
If
at
I
it.
was to prescribe, I would usually not start on two things at the same time as well. So I would start with estrogel and then maybe leave it to consideration, maybe a few months down the track. If there's still something you want to improve, then maybe testosterone, like a cream, a testosterone cream.
Yes,
Maybe
yeah,
helpful
that's
too.
I think I'm off tablets. I don't want to do any more tablets. So I think
But for me, I wouldn't start both at the same time.
Okay.
Just because then we don't know what's working, what's good, what's not so good.
But your talk was excellent, and I really appreciate it. And I'm following you now, so that's great. So who knows? I may see you too.
Oh, thank you. Great. All right.
Yeah.
No problem.
But thank you so much.
Thank you. Just leave it as a consideration basket. So keep following me and see if you need to.
I will. Okay. Thank you so much.
No problem. Thank you, Michelle.
Bye.
Anybody want to unmute and ask a question? Most welcome. If not, I will upload it to YouTube, and I'll email Wooty the link, and I'll email all the slides to Wooty and Matt, and then they can send it to your email. I don't know how they share it, but they can deal with it. Great. All right. Oh, thank you, Tarana. Thank you for the love heart. Appreciate it. Appreciate everyone coming on, and hopefully that just helps with your own journey. Thank you, Despina. I appreciate your comment that yes, I will share the slides, not a problem. It just goes into a PDF file, and I will just email it to Wooty, and that will be quite easy to share it. So I've just gathered it from lots of different places. No problem. All right. Well, I will stop recording and